Good evening to our friends in Europe and also in Asia. I must say late evening for Asia. And also good afternoon to our friends in the US and South America. I am Dominique Ducrest, the Executive Editor of IMCAS Academy, and I'm very pleased to welcome you for this June webinar. And today, the subject that we are going to talk is skin cooling techniques and its impact on laser application in dermatology. And before starting the webinar, I would like to introduce our faculty this evening. Our first speaker will be Dr. Hans LAUBACH. Good evening, Dr. LAUBACH.
Hello, Dominique. How are you?
Fine, thank you. Our second speaker will be Dr. Ashraf BADAWI. Good evening, Dr. BADAWI.
Hello, Dominique. It's my pleasure to be with you all.
Thank you. And thank you both to your strong commitment to those webinars. Thank you. And I would like to introduce the co-chair of this webinar, which is with me in Paris in the IMCAS studio, Dr. Barbara HERSANT from France, which is a plastic surgeon. Good evening, Dr. HERSANT.
Good evening.
And thank you to be here to help in the moderation of the Q&A session. So let me go quickly. Concerning, we have some partners when we do those webinars at IMCAS. And this evening we have 3 partners. And the first partner is the European Society for Laser and Energy-Based Device, the ESLD. ESLD is a great learning society, which is a sister society of the ADV, and which proposes you and is doing a great job in fostering laser application in dermatology. So you have here some various features, but I will hand over later on to Dr. LAUBACH, which is the president of ESLD, to present you in more detail all the functionality of this ESLD. And please do join ESLD, and you have the contact of the website. Our second partner is a society called Aesthetic Consilium School. It's a comprehensive system dedicated to training and complication resolution. It is mostly based in Eastern Europe. It is grouping today 8,000 participants. It does training. It has also conferences in Eastern Europe, and it has a good tool also to help complication in aesthetic medicine in general. So I would like to welcome Aesthetic Consilium. And this webinar is brought to you under a grant of a French company named Deleo that I would like to deeply thank for their support and their commitment. And here you have a training that they will do this weekend in the south of France. So if by any chance you are in the south of France, please join Deleo training over the weekend. Let me tell you a few things concerning IMCAS Academy. IMCAS Academy, in a nutshell, is it's an academic and social e-learning platform. Why academic? Because all the content that you find on IMCAS Academy has been reviewed by a group of various reviewers throughout the world. So this is for the academic part. Why social? Because the platform has been built in order to help exchange of information, and if you like some video that you can see, you can go and post some comments, ask questions to your peers, and you will enjoy a great interaction. Couple figures concerning IMCAS Academy since its launch 2 years ago. It has now over 2,000 videos, which is organized within 15 themes, which is either injectable, laser NABD, surgery, etc. And you have the possibility to post, comment, and questions. So I do encourage you to go and post comments and ask questions, because the more comments or the more questions we have, the richer the platform is becoming. And altogether, we have over 12,000 physicians in this group, and we have over 2,002 subscribers. And since the launch in 2016, now it's over 100,000 videos which has been viewed. On top of giving the access of various training throughout those videos, IMCAS Academy is offering some services. I'm going to be quick because that will be the subject of the second lecture. But IMCAS Alert is a tool to help you to manage your complication. There are three groups. In the comment of the middle of the slide, there are three groups. One group to help you to manage complication concerning injectable, a group to help you manage your complication with laser and EBD, and also a group looking after plastic surgery. So I deeply encourage you to go on the platform, and if you face complication, don't worry, all the complication that you post, this is done on an anonymous basis, and within 24, 48 hours, you have sometimes 20, over 30 answers from your peers in order to help you to manage those complications. In case you have challenging cases or inquiries, you can also post. So this is different than per se a complication, but you can get also the help from your peers. As we will go along the webinar, so we will have a first part concerning presentation, and then we'll have a Q&A session in roughly 30 minutes. And I do encourage you to go on the chat box and post your question, and we will handle them at the end of the webinar. So now I will like to stop, and I would like to hand over to our first speaker, Dr. LAUBACH, which is going to talk about us concerning the skin cooling techniques. To you, Dr. LAUBACH. Thank you very much.
Thank you, Dominic. Thank you so much. So I would like actually to see my slides on my screen. Well, there they are. Perfect. So I'm going to talk about skin cooling techniques today and its impact on laser application in dermatology. Actually, a very important issue considering our treatments, which actually often heat the skin, and skin cooling helps us to avoid those side effects that you've been talking about that we then later on report ideally on IMCAS Academy. Next slide, please. To disclose my conflict of interest, I'm actually advising Deleo, this company who is producing a cryolipolysis device called Cristal, and the other conflict of interest are probably not relevant to this lecture. Next slide, please. So the concept of selective photothermolysis is very important to understand, to make sure you understand the necessity of skin cooling. If you look at the skin temperature and the temperature, for example, of a target that you want to destroy, a dermal vessel, it's about 37 degrees Celsius roughly in normal human skin. Next slide, please. Now, if you send in laser photons of any light source, of laser or another light source, into the skin that are not highly absorbed by water, they penetrate into the skin. And if you choose the right color, you might get strong absorption, for example, in the hemoglobin molecule. This will then lead to increase of temperature of the hemoglobin and surrounding blood to over 100 degrees Celsius, whereas the dermal temperature and the epidermal temperature tends to stay rather cool. Next slide, please. Now, the epidermal temperature actually increases according to the melanin content. The darker the skin type, the more melanin you have. And since visible light is absorbed by melanin, any light you will use will heat up the epidermis. Lighter skin type heats us less, darker skin type heats up more. Next slide, please. So now, if you use the concept of selective photothermolysis, you're bound to use those photons that penetrate into the skin and are absorbed by melanin. Now that, as you can see in the diagram, it's just a rough estimate of temperatures reached within the epidermis using selective photothermolysis for the treatment of telangiectasias with the pulsar laser. If you have a very light skin type, epidermal temperatures will stay within the range of 40 to 45 degrees Celsius. For medium skin types, typical type 3 or 4, you'll reach already 50, 55 degrees Celsius. You will start seeing epidermal injury. And with dark skin types, it's virtually impossible to treat those darker skin types for underlying dermal vasculature. Next slide, please. This is basically one of these examples that you can see what happens if you actually heat up the epidermis without appropriate skin cooling, or if you misjudge your treatments. You can see epidermal crusting, epidermal sloughing. Looks extremely scary. As a matter of fact, it's just a basic epidermal injury, and with very good wound care, you will even get away without a permanent scar. However, you have to really be careful to do proper wound care. Next slide, please. Now, this is a little video I did with my thermal camera, and you can see here the importance of epidermal skin cooling. We actually have a contact cooling device. You can see that the area cooled down to 15 degrees Celsius compared to the surrounding skin that is about 30 or 37 degrees Celsius. Here we have 34 on the thermal camera image. So this actually makes you understand now better how this selective photothermolysis concept can get away with treating darker skin types. Next slide, please. Because if you cool down the epidermis to about 10 degrees Celsius, you have the target temperature still of 37 degrees Celsius. Next slide, please. You will then send in the photons, and you will increase the temperature of the epidermis about 30 degrees Celsius. Let's say before you had an epidermal temperature of 37, you would now be about 67 degrees Celsius. However, by epidermal skin cooling prior to laser impact, you actually increase from 10 degrees Celsius to 4 degrees Celsius, and now you can even treat medium skin types or even darker skin types without epidermal injury, and still heating up the dermal temperature of the vasculature to about 100 degrees Celsius. Next slide, please. So what are the current modalities of this important skin cooling? You basically have more or less two main cooling techniques. One is contact cooling and one is non-contact cooling. Contact cooling can actually differentiate between active and passive. Active, that means there's a continuously cooled, actively cooled agent like a sapphire window or a metal tip or copper tip. And the passive one is a cold agent that you put on the skin, but not actively cooled, for example, an ice cube or cold gels. You can see here, for example, a room temperature gel applied to the skin. It actually sufficiently reduces the skin temperature already to about 25 degrees Celsius if applied before the treatment, but this is not a very safe and very good cooling mechanism. There are better ones. The non-contact cooling techniques is basically based upon convection cooling. You have here typically the cryogen spray cooling or cold air cooling. Next slide, please. So then you can also differentiate the skin cooling modalities in the time point of cooling. You actually have the pre-treatment cooling, you have the parallel treatment cooling, and you have the post-treatment cooling. Next slide, please. This is one of those typical handpieces that use pre-treatment cooling. You have a pre-cooling plate, you have a laser aperture that actually then, after the skin has been cooled, hits the skin surface, and a distance gauge to make sure that you have the safe distance. Next slide, please. This is actually a thermal camera picture of the same handpiece, but in a cooled state. You can see that the pre-cooling plate homogeneously is cooled down to about 0 degrees Celsius, and you can see the opening for the laser beam actually hitting the skin afterwards. Thank you. Next slide, please. So this, again, it's a video of this contact pre-cooling. You can see if the laser is actually heating up the skin after the cooling device has cooled down the skin. It's another round of this image. You can see how nicely the skin is cooled, and you can see in this thermal camera the impact of the laser beam. And since I use an Nd:YAG laser, actually in the millisecond domain, you can see a heat wave coming up then from below the skin to heat up the epidermis after you have pre-cooled. But however, I think the most important of that is that you only have a one-directional treatment. You need to actually treat in one direction because you have pre-cooling to contact the skin before you actually hit with the laser beam. Next slide, please. So what are the advantages? Big advantage is actually the potency of this treatment, the potency of this cooling technique. You actually have a very solid to 0 degrees Celsius cooling. We have a very fast heat exchange. You can remove heat very easily and nicely. You can cool these metal plates very easily. So it's a very potent cooling technique. However, there are several disadvantages with this technique, and it makes it actually fall a little bit out of favor by now. Basically, if you don't have contact, there's no cooling, so you lack a little bit of safety. By accident, you could actually lose contact. No cooling would mean you might get epidermal injury. You cannot compress a tissue during the laser impact. The good cooling is operator dependent. If you do not touch the skin sufficiently enough before, you do not have sufficient cooling. Treatment needs to be in one direction. It's not bidirectional treatment. You have a poor visibility during treatment due to pre-cooling because your handpiece covers the area that you're treating before your laser beam hits. And you need thorough disinfection after use of your handpiece because you're in immediate contact. especially also since often a concomitant use of contact gel is recommended, and this can messy, especially in genital areas. Next slide, please. So how does contact parallel cooling look like? It's again, we are now in contact cooling. That means we need to touch the skin. You can see here one of the example of a cool sapphire window. At the same time, it's actually used as a laser and light aperture. Next slide, please. And it's an actively cooled window that can be cooled down to 5 degrees Celsius. You see here the thermal camera image that actually shows the temperature to be 13 degrees Celsius. Next slide, please. And however, what you need to be careful again is that you have to be always in very good contact with the skin to assure skin cooling. Also, please make sure that that the cooling device is properly functioning, and touch the device before you start treating a patient to make sure you have the required target temperatures. You can see here a little video of a thermal camera image of the treatment with an IPL using contact cooling and a actively cooled sapphire window. You can see the treatment area is hardly heating up during the treatment. Next slide, please. So what are the advantages and disadvantages of this technique? It's definitely also a very potent cooling technique due to the contact, removes actively very nicely the heat. Can remove also the pain. There's no good data out there, but in my opinion, it actually does help a lot for pain reduction. And also you can use this technique to compress the skin, which makes sure, first of all, that you have good contact, so there's elasticity, but not only that, it reduces the chromophore of hemoglobin. If you press hard on the skin, the vessels are actually blanched, and that actually makes sure that you might have a better efficacy in laser hair removal, because the hemoglobin is actually a chromophore that also concurrents your photons with the melanin. Also, if you press on the skin, hair follicles tend to be closer than to the skin surface, and you might have a better treatment. Disadvantages of that are plenty as well. Blocking again of the visibility of the treatment area. While you treat, you cannot see the area that you treat immediately. We have no contact equals no cooling, so be careful, especially in the areas of the shins where you have an uneven surface area, or also, especially also in the genital area, where you really might get into trouble with these contact coolings, because to cover the area nicely and evenly is quite difficult. Also, the concomitant use of contact gel is messy, stays messy, and you really need to do a thorough cleaning, disinfection after use. Next slide. Cold air cooling. This is a typical handpiece using cold air. You have a stream of cold air, typically up to -30 degrees Celsius, to cool the skin. And actually, it's the only device that's actually out there, or the only cooling technique that's out there that you can use for pre, parallel, and post-cooling. That would be an ideal world. You can see the laser aperture, the air aperture, and actually the air actually arrives at an angle, so the air actually hits the skin perfectly on the level of the skin surface. You can see the distance gauge is actually perfectly aligned with that. So next slide, please. Be careful that you align horizontally and that you treat evenly, because otherwise your cold air again is not hitting the skin at the same place where your laser hits. But as you can see very nicely in this treatment video, you have a very sufficient pre-cooling before the laser beam hits. The skin is already cold. The laser is on while the air is flowing, so you have a parallel cooling. And also you have a post-cooling still very effectively when you treat. Next slide, please. So what are the advantages? It's a secure cooling technique for the operator, because it becomes a little bit more operator independent. Even without good contact, you have very good cooling. It reduces effectively pain. Is it as effectively as contact cooling by a sapphire window? It remains debatable. No data out there so far. Maybe there will be a trial eventually. However, for me, the big point is the optimal visibility. This actually lets you have visibility at the entire time of the treatment area, and makes a technique very easy to use. Also, it's the only technique that's pre-parallel and post-cooling. Handpiece can be constructed very lightly because it doesn't weigh anything to channel cold air through the handpiece. You don't need to have any active cooling. You don't need to have to water in the handpiece. And certainly there's no gel needed, so it's less messy. Disadvantages: you cannot compress tissue. It's quite noisy as well. The cold air is actually, the generator of the cold air is quite noisy if used on high settings especially. Post-cooling, and you will see that it's not really assured, but that is operator dependent. If you move the handpiece right after the last impact, you will have less post-cooling. And the interior lens of the device needs a lot of cleaning because it becomes quite messed up with, for example, if you do hair removal with the debris from the removed hair. Next slide, please. So there is another technique that is non-contact. It's called cryogen cooling. You have different cryogens used. There was liquid nitrogen used, but then you had quite some cases of cryonecrosis. You have now mostly a more modern type of cryogen cooling. And then there's actually the possibility to cool before and after. However, with the cryogen cooling, you cannot cool during the impact of the laser beam because of the mist that you're creating. The laser does not penetrate the mist. However, it is a very potent cooling technique, so you can remove sufficiently the heat of the skin within the millisecond domain. And you can also adjust this millisecond domain very nicely. It becomes a very user-friendly technique. You have a full control of your cooling. You also have full control of your interval in between the cooling impact and the laser impact. Next slide, please. So this is, again, a thermal camera video of one of these devices using a cryogen cooling technique with hair removal and the egg laser for hair removal, typical hair removal settings. And you can see how the device actually pre-cools before the treatment. You can actually not really see it because the millisecond domain is an interval. The human eye cannot differentiate these intervals anymore. Also, again, tissue compression is not possible. Next slide, please. Advantages: very short and potent heat extraction, no gel needed, user independent in its efficacy, certainly good visibility during treatment, again, similar to the cold air cooling. Disadvantages: you cannot really control its proper function. You can just hear a pshit if you listen to the device. Please fire once in the air to make sure that this kind of forced cryogen, you can hear the functioning, but then it's in the millisecond domain, so we do not really appreciate those domains anymore. We do not know, is it really 10 milliseconds or 20 milliseconds of cooling? Maybe the device is firing 40 milliseconds, so we're completely dependent on the producer. Cryogen parameters are difficult to adjust because of that, because it's not really intuitive. It's for a novice. It's very difficult to adjust those. Tissue compression, definitely not possible. The cryogen spurt, if you increase the cryogen, can be painful by itself, sometimes even more painful than the laser. And it can induce PIH. There are publications out there about the arcuate shape. In my opinion, that's more a problem of flexibility, kind of like a device adjustment. And then lastly, it emits chlorofluorocarbons with the modern cooling, cryogen cooling. And that for that case, actually, it's not allowed to be used in Switzerland, for example. Next slide, please. So there are a lot of data out there comparing those cooling devices preclinically in a theoretically session. There's one of those publications comparing contact cooling with the cryogen cooling. And well, in my opinion, it actually makes a lot of sense in theory, but then in practice, there's actually nothing at all out there comparing those cooling techniques sufficiently clinically with good scientific evidence. Next slide, please. So just to show you some of those problems you might encounter. So we have a pre-cooling problem. You can see here, I cool the skin before, I fire once, and you can see if I don't pre-cool the area that I treat, I actually might miss the first spot. So make sure that you slide and then fire after you have started sliding the handpiece. Otherwise, you have the short spot at about 40, 42 degrees Celsius. So if you do that with more limited parameters, more on the edge where you actually are depending on the cooling, you will not get away with it. You have a crust. So once again, you can see here, I start with cooling the skin, but I fire without having pre-cooled. So I fire without having treated into the pre-cooled tissue. So please make sure that you move the handpiece and then start firing. Okay, next slide, please. Another problem is basically with the sapphire contact cooling. You can see now how actually you have an uneven cooling due to an uneven surface area. You can see here now on the lower part how the skin heats up to about 32, 30 degrees Celsius, whereas the other areas that have had very good contact with the cooling device are actually staying quite cool. You can see again where it starts to be uneven is actually the underarm. That you can see that it becomes difficult if the surface area that you're treating is actually shaped and has some bends in it. Next slide, please. Conclusion. Every cooling technique has its advantages and disadvantages. I think that you have seen there is not one single technique as an ideal technique. It's user dependent still a lot, some more, some less. But actually at the moment, I think the pre-cooling gets out of favor. The non-active contact cooling also gets out of favor. So at the moment, active contact cooling and non-contact cooling are actually the way to go. However, scientific evidence comparing these different cooling techniques are clinically very sparse. In my opinion, it depends who's treating, when are you treating, which skin type you're treating. It's very difficult to actually suggest or to recommend one typical skin cooling technique. Yeah, we need to complete. Okay, and I'll finish my talk then. I'll let you take over, Dominic. Thank you so much.
Can just go back. Can you go back to the last slide of Dr. LAUBACH, because I would like him to present about ESLD, because this,
sure,
this is important.
Sure. Okay, good. Yeah, thank you so much, Dominic. So just one word about the ESID. So the ESID stands for European Society for Laser and Energy-Based Devices. We are a physician society. We have about 500 members, and we are a non-for-profit or society committed to excellence in laser and energy-based devices in dermatology and all other medical specialties. We have a lot of dedicated sessions in major conferences worldwide. For example, we have a very strong relationship with IMCAS, if you can see. We have very good hands-on teaching with our ESID hands-on teaching courses. They are held twice a year in Europe or otherwise. We also somehow try to foster people who are interested, especially students and residents, get granted to come and be taught at these hands-on teaching courses. Also, they have free membership in our societies. The next teaching courses will be in Romania and in Italy. Please come and join us if you like, if you want to know more about it. You have very good, solid interaction with the 5 or 6 teachers during 2 days. At least half of the time is dedicated to hands-on sessions. So come and join us. Look at the website, esid.eu, to get more of the information. Thank you so much, Dominic, again.
Thank you very much, Dr. LAUBACH. I would like to hand over, before going to Dr. Badawi presentation, to Dr. HERSANT. Maybe she has a question for you.
So thank you, Dr. LAUBACH, for your very interesting presentation. Is it possible to use skin cooling technique in association with laser in genital area, especially in vulva and vagina area?
Oh yeah, very important actually to use it. You have, especially in those areas, often a lot of pigment, much more pigment that you would have in normal skin type, in the skin that you would have outside of the genital area, due to friction, due to genetical predisposition. And as you have seen in the first slide, selective photothermolysis, which we're using, for example, for hair removal, is dependent a lot on the on skin type and mostly of skin pigmentation. So the more pigment you have, the better you need to cool down the epidermis. For these areas, I actually like the best personally, in my personal experience, actually the cold air cooling, because you do not have contact, you do not need gel. It's a very sufficient cooling. For me, it's probably the best, especially in the area of the labia, because you basically don't need contact. You still stay somehow safe. It's a very difficult area to treat if you go for more intense settings and higher energy settings.
Thank you.
Just a last question to you, Dr. LAUBACH. You have mentioned a couple of times that issue might come because in couple cases it can be operator dependent. So what will be the single advice that you will give to our audience in order to avoid operator dependent, skin cooling techniques issues? You see, one single advice.
Get trained.
Okay. Okay. That's what I thought, okay? Okay, thank you. So we'll jump now to the presentation of Dr. Badawi, which is going to review about IMCAS Alert as a tool to help you to manage your complication. Dr. Badawi, this is for you. Thank you so much.
Welcome to the IMCAS Academy webinar about skin cooling techniques and its impact on laser application dermatology. I'm very happy and honored to be part of this webinar with great faculty and moderator. My presentation now is about IMCAS Alert, a tool to help you managing complications. IMCAS Alert is a unique tool for your complications, which is available for IMCAS Academy members. In case you are facing any treatment complications or even inquiries, then you can submit anonymously your clinical case or inquiry to the board of experts, the key opinion leaders all over the world, and usually you will get their opinion and advice in less than a day. In many cases, in few hours, you are going to get an answer. So far, we have 64 cases posted on IMCAS Alert, which is addressing different indications, different cases, some inquiries, as we can see, or some complications in other cases. Actually, each case of those are considered a learning experience by itself, because we have the case presented by the author, who is anonymous. No one knows who presented that case. And then we have, as we can see, different experts in the field who are giving their comments, suggestions, and how to resolve the issue or how to avoid the complications in the future. As our webinar today is about cooling, so I just highlighted some cases presented on the IMCAS Alert, which are related to the cooling. So, for example, this is a case of scarring after Nd:YAG laser treatment for facial telangiectasia, and as we can see, a description of the case, and the author is writing that this case was treated with long pulse Nd:YAG with no cooling, and he is asking if there is a way to minimize the scar formation after the laser treatment. So this is a case where Nd:YAG was used to treat vascular lesion without the appropriate cooling. This is something which should not happen. Another case of venous malformation of the lip, and asking about the treatment with Nd:YAG long pulse laser, and actually this is a case of inquiry, so it's not a complication. This patient, 30 years old male, who was treated previously with 3 sessions of interstitial laser by an ENT doctor, and this happened after progression of the venous malformation. And also it is highlighting that the MRI found a subcutaneous venous malformation on the left labial area, as we can see, and the author was asking if Nd:YAG can be used and which parameters. So Dr. Michael Benzacqui, who is a dermatologist from France, was one of the people who responded to this inquiry, and according to the French Laser Group Expert Forum, he mentioned that there were some suggestions of using the long pulse Nd:YAG under local anesthesia with pulse duration of 30 to 40 milliseconds, smaller spot size 3 to 4 millimeter, with fluence ranging between 150 to 170 joule per centimeter square. And this was the suggested parameters. Now, this is something I agree with. However, we have to know that the Nd:YAG laser, the 1064 Nd:YAG, is a laser which is not very selective. It's absorbed by melanin, by oxyhemoglobin, and by water. So it is not very selective. When we are using relatively high fluence, like the suggested one here, it's important to make sure that we are protecting the skin in order to avoid scarring. So in this case, cooling plays a very important role in that application. So skin cooling, it has been addressed by Dr. LAUBACH. We can have contact cooling, where we can use ice cubes or ice packs. We can use ice gels, or sometimes the laser handpiece itself is having a cold conductor like chill tip, metal cooling finger, or sapphire lens. So this is called contact cooling. On the other hand, we have non-contact cooling, like using cold air or cryogen sprays. So those are different types of cooling. Sometimes in treating vascular lesions, it's important to use more than one type of cooling. So we might be using the cold air, which is pumping air on the skin during the laser, before the laser, and after the laser. But in addition to that, we might need to use contact cooling as well, like ice cubes, in order to avoid any scarring and damage of the skin. So this is a very important precaution, especially when we are dealing with vascular lesions like the previous two cases, whether it's telangiectasia in the face or venous lake or any other vascular lesion, whether it's in the face or in the leg. Using the cooling in these cases is mandatory and very important to avoid skin damage and scarring after the use of long pulse Nd:EG in treating vascular lesions. Another case which shows the importance of the cooling. So this is a case which was presented on Incas Alert about skin discoloration after IPL treatment for hair removal on lower limbs. And as we can see, this was described as skin discoloration because the author was not sure if this is hyperpigmentation or scabbing and crusting. And to answer that, it's important to know the onset of the incident after the treatment. So if it is a few days after the treatment, this is usually a superficial burn, and this is the case in this particular case. And this happened due to incomplete or insufficient cooling of the skin. So the areas when we have contact cooling, it's very important to make sure that the full surface of the cooling handpiece or cooling tip is in contact with the skin. In this case, some areas were in good contact, whereas the other areas, which are the curves, are not in contact with the skin. So in this case, this area is going to be exposed to the light or the laser without the protection of cooling. That's why it's really very important when we are using contact cooling to make sure that the full surface of the skin is covered with the contact cooling surface of the handpiece of the laser, so that we avoid any skin damage and burn as happened in this case. This is another case presented on IMCAS Alert about skin burn after depilatory laser or hair removal laser, and we can see that, as described by the author, the spots are in the shape of half moon, and it is suggested that it might be due to residual hair debris on the handpiece or problem with the cooling system. So if there is an issue with the cooling, so the cooling is not effective or the hose of the cooling system is kinked, then there will be no enough cold air on the skin, which can cause the burn, as happened in this case. On the other hand, some cases of cryogen spray devices might have also some burns like that, and this might be due to the wrong placement of the handpiece on the skin. If the handpiece is not perpendicular on the skin, if it is tilted, then the cryogen might hit the edge of the handpiece, and this will protect the cryogen from going into the skin, whereas the laser will hit the skin without the protection of the cryogen. So this is another reason where we might have failure of the cooling system, and this might be associated with burning the skin. That's why cooling plays a very important and vital role in protecting the skin in different laser applications, as we can see in those applications and those cases present in the IMCAS Alert. Another case which was presented in March 2017 was paradoxical hair growth, which was presented by an author, a dermatologist, and the patient was treated with diode laser in another clinic, and then presented with more hair growth after the treatment. And the author was asking if which laser should be used, and any investigations and any suggested is to make sure that we are having good cooling of the skin, because if we are using contact cooling or cryogen cooling, which is pre-cooling for the skin before the laser, this means that the laser will be applied on the skin. Only the area which is cooled, whether with cryogen or contact cooling, is going to be cooled, whereas the surrounding area is going to be affected by the lower intensity of laser, which might lead to photobiostimulation. So in this case, it is really very much advisable to use bulk cooling, like the cold air cooling, because this is going to decrease and minimize this phenomena of paradoxical hair growth if there is no underlying pathology. Of course, if there is any underlying pathology, it has to be treated like PCA or hormonal disturbances. However, good cooling of the skin, not only in the treated area but also the surrounding area, plays a very important role to minimize the incidence of paradoxical hair growth. So this was another important application of skin cooling in laser-assisted hair reduction. Another case which was presented on the alert is a case of skin burn after cryotherapy, and we can see the description of the case where the patient was treated 2 times with the same cryotherapy or cryolipolysis device without a problem. However, when the 3rd session took place with the same machine with maximum cooling and maximum suction, the patient had this kind of burn. We had some comments from some of the experts, Dr. Michael Bernard from Belgium and Dr. Diane Duncan from the United States, where they commented about the reason of this incident, and there was suggestion to contact the device manufacturer and make sure that the machine is performing well before using it on another patient. Sometimes it might be failure due to the machine. Some machines are not up to the standard. So again, this is something which really plays a very important role, and I think the cryolipolysis was presented by Dr. Laubach in the previous talk. So as we can see, IMCAS Alert is a very important tool in our hands in order to be able to submit our cases or inquiries, and this is something which might improve our results and our understanding of the problems to avoid future similar problems in our patients. So how to submit your case? You need to subscribe to IMCAS Academy from this link, and then log to IMCAS Alert and post your case. We have so far 3 IMCAS Alert services, which are the injectable and threads, lasers and energy-based devices, and breast surgery. Those are 3 sections which you can choose from according to the case you would like to post, whether it is inquiry or complication. For the laser and energy-based devices, I have the pleasure to be one of the coordinators along with Dr. Cartier from France. So we manage that area. So this is the link to IMCAS Alert, and we'll be very happy to see you joining us at the IMCAS Alert. Even if you don't have anything to post, just going through the 64 cases is a very good learning experience, which I strongly encourage you to do. And going through the discussions, the case description, and the suggestion by the different experts all over the world is a very good enhancement of our knowledge in this area. Thank you very much for your attention, and if there are any questions, please feel free to send them to the administrator of the webinar. Thank you and all the best.
Thank you very much, Dr. Badawi. It's quite amazing to see how rich this tool has become. And I think there are a lot of great educational outcomes which can be obtained from this very unique way of helping doctors. I just want to mention 2 things. First is in IMCAS Alert, in all those groups, you can find both complication and inquiries. At the start, it was only complication, but IMCAS has added up inquiries because sometimes you might not have a complication, but you will like to have some information, some advice from your peers, so you are also able to ask inquiries. So other inquiries or complication. And I would like also to mention that as after more than a year of having IMCAS Alert, we see it is a very, the content which is there, has a lot of benefits for education. And in the IMCAS Congress, which will become in the future, and the next one will be in Asia in July, within the program of IMCAS, you have dedicated session to complication. So I will definitely encourage you to join and come and see how rich this content is. So now I would like to hand over to Dr. HERSANT, which might have a couple questions for our two speakers.
Thank you, Dr. Badawi. I have a question for you. Can the skin cooling technique decrease the efficacy of laser treatment of vascular lesions?
Can't hear.
We can't hear you, Ashraf.
Okay, now.
Very good.
Okay, so it's a very good question, and actually we had a concern about this question when we started treating vascular lesions with laser, because we were thinking that if we use intense cooling to cool the skin, this will cause vasoconstriction, which is going to minimize the efficacy of the laser treatment. However, in most of the cases, we are treating capillaries, and capillaries are not having a muscular layer in the wall, so it does not show vasoconstriction. So in most of the cases, cryogen cooling or cold air cooling is not going to affect or impact the efficacy of the laser treatment. However, if we are using contact cooling, this is the trick, because if we use contact cooling and we compress the skin too much, this is going to squeeze the blood out of the blood vessel, and then there is no chromophore, so nothing to absorb the laser. So in this case, if your device is having contact cooling, then it should be just mildly touching the surface of the skin without too much pressure, so that you are having the chromophore, you are not squeezing the blood out of the vessel, and you maintain the efficacy. So this is regarding the cooling with vascular lesions.
Thank you very much. I have a question for Dr. LAUBACH. So is it possible to use a skin cooling technique with laser outside of photothermolysis treatment?
It's actually very interesting to use it outside of selective photothermolysis concept, especially if you use skin cooling as an analgesic tool. Cooling the skin actually inhibits nerve fibers to fire. And with that, you actually have a good tool to make any kind of laser treatments more acceptable by the patient, especially if you use, for example, fractional photothermolysis to protect not only the epidermis, but also to make sure that the treatment becomes tolerable. Skin cooling is very potent. And here you have two different types, the fraction ablative, non-ablative. And I think it's a good adjunct to the treatment. I think any intervention that we do as physicians with our patients profit from skin cooling if they are painful. So even outside of laser therapy, doing injectables or any kind of painful procedure actually could profit from sufficient skin cooling to decrease the sensitivity of the skin.
So thank you for your answer. Dr. Badawi, why cold air cooling is more preferred than cryogen or contact cooling?
I think this is something which was highlighted during the presentation of Hans. With the cold air cooling, we have parallel cooling. So we have cooling to the bulk, cooling to the area. So the area of treatment is going to be cooled before the laser pulse, during the laser pulse, and even after the laser pulse, because we are not only cooling a spot, but we are cooling an area. This is number one. Number two, there is no interference with the laser tissue interaction. With a cryogen, the cryogen is going to be sprayed on the skin just before the laser pulse. So this might lead to a little bit more increase in the reflection and scattering of the laser beam. Whereas with the cold air, there is no interference with the laser beam, and this might be associated with some cases of decrease of efficacy of the treatment in case if we are treating very fine vascular lesions or fine hair. In this case, we don't want to decrease the efficacy of the laser. So the cryogen might be having an advantage in this area. The third thing is that with the cold air, there is no consumable. So there is no increased running cost. Whereas with the cryogen, there is a consumable and each pulse costs something. So those are the reasons why I personally think that the cold air cooling is having more advantages over the cryogen cooling. Plus, of course, all the issues and reports mentioned by Hans during his presentation that the potential risk of hyperpigmentation, which might be associated with some case of cryogen, this is not the case with the cold air.
Dr. LAUBACH, how long the skin should be cooled after a laser session?
Well, that's a good question. Actually, I would just like to add one point to what Ashraf BADAWI said before about reports of cold air and hyperpigmentation. Unfortunately, there's one publication out there showing that you can induce hyperpigmentation with cold air if you overcool. And that's coming back to your question, how long should you cool? I think sufficiently so the patient doesn't feel the pain, but don't overcool the skin either, because there's this one publication with cold air where they pre and post cooled for 30 seconds with cold air at minus 30 degrees Celsius, and that was sufficiently cold enough to irritate the skin to induce hyperpigmentation. So considering the cooling after the treatment, I usually use gentle cooling. I don't go to these more aggressive types of cooling like forced air with minus 30 degrees Celsius. I rather recommend a cooling mask or basically some cooling lotions coming out of the fridge to make sure that you have a gentle cooling process of the heat that is still within the skin. Also putting on an additional layer on top of the skin actually removes the skin air interface efficiently, so you have contact with something, with a liquid, with the skin, so the skin can actually get rid of the heat, especially the epidermis can get rid of the heat better. Since air is an insulator, it doesn't really help you to remove heat from the skin. So I would actually suggest to use gentle cooling techniques, and then the duration of post-treatment cooling is not really an issue anymore. I usually recommend it to my patients as long as it feels good to them. It's actually a sufficient cooling.
Okay, I just have a question from Dr. Warda Gerges from Israel. She says that I could not understand the relation between cooling system and hair growth. So maybe Dr. LAUBACH, I don't know, whatever.
Well, the connection is actually that we use a technique of selective photothermolysis to do laser hair removal. Now, to do laser hair removal with selective photothermolysis, you would actually need to heat the melanin of the hair bulb. At the same time, you're heating up the melanin of the epidermis. So that actually lets you interact your photons with the epidermal melanin and with the melanin of the hair bulb. But you do not want to heat up the epidermal melanin to a degree that actually harms the epidermis, so about 50, 55 degrees Celsius. So you can actually overcome the issues with darker pigment types, with darker skin types, by decreasing epidermal temperatures before or during the laser impact. And that is actually a connection between laser hair removal and skin cooling.
Okay.
Let me add something to the answer of Hans. When we are cooling the skin during the process of hair removal, if we are using pre-cooling, like in case of cryogen, or contact cooling, or parallel cooling, like using the diode, we are cooling only the area which is going to be exposed to the laser. So this area is going to be protected. We are going to have the appropriate fluence and energy which is hitting the hair follicles. However, in the surrounding area, there will be collateral thermal spread. And in this case, the areas which are surrounding this area is going to be exposed to the laser or the heat of the laser without appropriate cooling. And this might lead to photobiostimulation instead of the desired effect Hans described, which is the selective photothermolysis. We are going to have an area which is having just mild heating of the skin, and this will lead to photobiostimulation and might increase and stimulate the hair growth by increasing the perfusion, the blood supply to the area, and vasodilatation. So that's why there are some links between the cooling, if it is not bulk cooling, and the paradoxical hair growth in the areas surrounding the treatment area. And this is why we have observed that some patients who are being treated for hair reduction in the chin area, for example, they are going to have hair growth in the neck, in the surrounding area. So this might be one of the explanations and one of the theories of developing paradoxical hair growth. So also this is mentioned by Hans, that we need to cool the area very appropriately. If we don't have cold air cooling, if it is cryogen or contact cooling, it's advisable to use cold air, cold packs for the whole area, the treatment area and the surrounding area, for about 10 minutes, 15 minutes after the session. And this might contribute to reduction of the incidence of paradoxical hair growth, of course, after controlling all the other elements, which is appropriate parameters and treating any underlying pathology in this condition.
Thank you.
Okay, thank you. Dr. Badawi, why cryogen cooling devices are associated sometimes with hyperpigmentation, especially in dark skin?
Yeah, again, this is something which was highlighted by Dr. Laubach. One of two things: either the cryogen itself, the temperature drop is too much, so it's going to cause some damage to the irritation to the melanosomes, melanocytes, to produce more melanin. So this can be associated with hyperpigmentation. But also, as I mentioned in one of the cases I presented, if the handpiece is not appropriately placed on the skin with the perpendicular direction, then if the handpiece is tilted, the cryogen is going to hit the side of the handpiece, and this will prevent the cryogen from being applied to the skin. However, the laser is going to hit the surface of the skin, and this can cause damage to the epidermis and the skin, and the result of hyperpigmentation. That's why it's very important to use appropriate technique in order to prevent this phenomena.
Dr. LAUBACH, I have a question for you. Can cold air cooling induce post-inflammatory hyperpigmentation?
Yes, it can. I think anything that irritates the skin can actually induce PIH. And as I said before, there's this very interesting publication from our colleague Vorapong from Bangkok, who showed clearly that by overdoing cold air cooling, you can induce hyperpigmentation, especially in skin types prone to PIH, for example, the Asian skin types. So he was using in his publication 30 seconds of pre-cooling, laser treatment, 30 seconds of post-cooling, and showing that actually a significant amount of patients had that hyperpigmentation. In my practice, I haven't seen it using cold air. I treat my patients with very high settings, with the maximum setting of cold air, and I have not seen one case with hyperpigmentation, post-inflammatory hyperpigmentation, due to the cold air. So I think it's a question of dosage of coldness. If you use too much cold, you get hyperpigmentation due to irritation. And very interestingly, if you use enough cold precisely, the group around Professor Manstein, Professor Anderson, and Professor Chan from Hong Kong have shown that you can significantly reduce pigmentation as a new treatment modality for selective cryolysis. So there's a lot of things we do not 100% understand yet, but I think cold air has a huge future used in the right dose. And to come back to your questions, it can definitely induce hyperpigmentation if used not correctly.
I have a question for Dr. Laubach. Dr. Laubach, you are one of the people who were in the team of inventors of the fractional photothermolysis. And this is something which we use either in ablative or non-ablative manner, usually with topical anesthesia, with topical anesthetic cream. So do you think the cold air or any other form of cooling is advisable after those treatments or before or during those treatments, whether it is if it is non-ablative or even the ablative, with a potential risk of pumping anything into the skin? Do you think there is a need for that? Is there any risk of using any kind of cooling with that technique?
So most of the non-ablative fractional photothermolysis devices have some type of parallel cooling. It's either cold air with most of them. There's one device out there that has actually actively cooled sapphire tip during the treatment, during the non-ablative fractional photothermolysis treatment. So we have parallel cooling with a sapphire tip or parallel cooling with contact with cold air. It's more difficult for the ablative fractional photothermolysis technique because sapphire tip is not possible. The CO2 or erbium would be absorbed by the sapphire tip, so you cannot treat through a sapphire tip. And the only possible cooling is actually cold air. And for me, that I do use frequently to reduce treatment-related pain. But at the same time, you then are basically blowing away the fumes. Your fume evacuation is less efficient. Depends a little bit what you're doing, how you're doing. You should definitely do the fume evacuation in line with your cold convection air. But I use cold air if the patient complains about pain. If it's the topical anesthesia I always use, but if that's enough, I try to stay away from cold air because it actually makes the fumes go all over the room. So that's definitely something I would consider, considering the safety of the treatment. But then I think after cooling, post-cooling, be careful what you put on your skin. If you put a neutral gel on the skin, that might be sterile even at best. You can actually put that in the fridge and cool down the skin afterwards, which is great. Or some sterile saline solution is great as well. Anything that actually is sterile is fine, but be very careful after ablative fractional photothermolysis what you put on your skin, also to cool down the skin afterwards because it actually penetrates into the skin and might come back with a vengeance.
Okay, thank you.
I have a question from Dr. Chanda coming from Cambodia that I would like to thank because this is midnight for him. So thank you very much to be there, Dr. Chanda. Dr. LAUBACH, you have mentioned that for vascular lesion, we should use more than one cooling technique. For IPL, it has its own cooling setting already. So can we use cold air cooling more and when? Pre, during, or post?
Yeah, it's interesting actually. You can definitely use a combination of different cooling techniques. So let's say you have a sapphire window IPL for treatment of vascular lesions, actively cooled. The modern ones mostly have that. You could actually make an argument why not cool down the skin before as a pre-cooling with an additional cold air cooling technique in parallel. I usually do not tend to do that because with an actively cooled sapphire window, you have a very potent device, but then make sure you have good contact. And if you did pre-cool the skin with some cold air before treatment, and so in parallel, you would actually gain some safety. Would you reduce the efficacy? Good question. Couldn't argue on that. No data out there. Basically, I don't know.
Thank you.
Thank you. We have a question published on the chat box for Dr. LAUBACH. What is your preferred skin cooling technique for laser hair removal?
question. Depends on several parameters. I think one that I could actually really say a strong favor would be the genital area with a non-contact cooling technique, mostly because of hygiene and also the safety of the with assuring having sufficient contact with contact cooling. That area becomes very tricky because it's a very uneven area. So for me, that is definitely a goal for non-contact cooling. However, if I look, for example, the back, I would actually prefer to have a good contact cooling device because in my experience, it reduces treatment-associated pain better than the non-contact cooling devices. That's just the two different types. And then you also have the skin type that then counts into the whole system. I think it depends a lot on the region that you're treating.
Okay, before we are running late already, so before going to the conclusion, I would like to ask to our two speakers whether they have any other comment to make after their presentation and this Q&A session. Dr. Badawi, do you have something else that you would like, a key takeaway message that you would like to give away?
Yeah, I just would like to invite everyone to go to the Incas Alert website and go through the cases. It's really very valuable tool, and you will find so many interesting cases to learn from that. The other thing is to also, I would like to invite everyone to visit the ESID website and check our activities and the benefits of becoming a member. It's a very good opportunity for those who would like to be more advanced on the lasers and energy-based devices, and we welcome all the colleagues to join us during those activities. And thank you very much for your attention.
Dr. LAUBACH, do you want one final comment?
Yeah, sure. Thank you most of all for the great collaboration that IMCAS is providing for ESID, and I'm very happy that two societies are working together. I would like, considering the cooling techniques, just one comment. As you mentioned before, what is the one advice you would give? Basically, it's very difficult to actually explain all of this and to show you how to do good, proper cooling technique in a theoretical session, even in videos. If you want to actually be well trained, come and join us for one of our teaching courses. We'll show you how to hold the handpiece, which type of cooling is out there, which is appropriate for which region. So please come and join us for one of our hands-on sessions to get more specific hands-on education.
Thank you, Dr. LAUBACH. Can I have my last slide for the next webinar? Before going to my conclusion, I would like to thank very much our faculty, Dr. LAUBACH and Dr. Badawi. Again, that was stunning, very interesting, and I guess a lot of interesting information for our audience on the web. So thank you very much to your presence and your commitment. I would like also to thank you, Dr. HERSANT. Thank you very much to have come over from your hospital in Paris.
Thank you to invite me.
Merci. And I would like also to thank our scientific partners for this webinar today, which was ESLD, Aesthetic Consilium, and our industry partner, which was Deleo. Let me tell you quickly about the next webinar, which is planned on July 18 in 3 weeks' time from now. And we are going to talk about toxin and filler difficult cases and how to manage. We will have two main presentations. The first one, which will be done by Dr. Patrick Tracy from Ireland, which is going to share a couple pearls of difficult cases that he has encountered in the recent past. And then we will have Dr. Thomas Rappel from Austria, which is a plastic surgeon, which will also review the IMCAS Alert as a tool to manage not the laser complication, but this time the injectable complication. And we will have in Paris a good team to handle the Q&A with 3 doctors, Dr. Moll, which is plastic surgeon, Dr. Kalouf, which is a dermatologist from France, and also will be online Dr. Rudenko from Ukraine, which is also a dermatologist. And I will be moderating this session. And we have 3 scientific partners for this event, which is Real Self out of the US, Aesthetic Consilium once more, and the GEDEC. The GEDEC is a group dealing in aesthetic dermatology, which is affiliated to the French Learning Society. Last thing, which is very important, you all know in the world that mid of July is a time which is critical. Why? Because on 13 and 14 of July, you will have the semi-final and the final of the World Cup. However, there is something also happening on the same weekend. This is IMCAS Asia in Bangkok. So if you are in the region, if you are in Bangkok, or if you like to travel, please go to IMCAS Asia in Bangkok, and you will have to trade off between the session and the final or the semi-final, but don't worry, that will be a different set of time. So thank you very much for our audience. Thank you for the speaker once more, and à bientôt, and bonsoir.